if we take a system analysis, we would not look so much in what is public and private, but who is regulating, who is governing the system, and what are the rules. In other terms, the role of government, regulation, part of governance, the type of actors, it's, the governance, employers and trade union may be part of it when you have a social health insurance system, and what are the collective aims from which the rules will spring off, the foundation of our house. So, and the basic distinction comes out is again three different categories, but then we will see there are also subcategories. You will have national health services, and I insist on the word service, NHS, so National Health Service Systems. The typical example is England or the United Kingdom, where the state manages the system. It manages all the three functions, the regulation, the distribution, and the funding. It's all sort of government organized. And there are private actors in it. General practitioners, for instance, are independent, but they all have a contract with this National Health Service, and they have precise rules about how they're paid and what they have to do with their patients and so on. You have social insurance, health insurance systems, social health insurance systems. These are these Bismarckian systems, which were started with Otto von Bismarck in Germany and then developed and modernized. And you can have what we would call commercial health insurance systems, who are there like a car company to make profit. A social health insurance, its goal is not to make profits. Its goal is to cover the population with the given money, with the contribution they receive to cover their health needs. A commercial health insurance will try to insure all the healthy people who earn a lot of money, and then they can pay a lot of premium and will never be ill. But they don't want the old, poor people who can't pay much premiums and cost a lot of money because they're very ill all the time with chronic conditions and cancer and all this. So this is the basic categorization we have today for healthcare systems. When we look from the basic of these three basic functions. Now, to describe them a little bit more, there is a basic difference between the National Health Service systems and the health insurance systems. Because the National Health Service system, it provides the service totally. It is public authority organizing all the three functions: regulation, funding, and service distribution. They're public. It is paid from the public budget by the general taxes. The taxes people pay to the government, and the government will decide in the public budget so much will go to the healthcare system, and then it will be divided between all the different parts of the healthcare system. It means public hospitals. Doctors are in general salaried or salaried under salary. In hospitals or even in ambulatory care, or they are under contract with the public organizations, these British GPs, for instance. Service is free of charge for the users or with a very small out-of-pocket payment. OOP means out of pocket, but I pay for my pocket. So for cost containment, most healthcare systems in Europe introduce some sort of out-of-pocket payment to moderate the use of medical services, that people don't go to the doctor if it's not necessary, or don't take pills which are not necessary and then throw them away. So there are little charges. In France, for instance, you have to pay 50 pence, €0.50, for each prescribed medicine on your prescription. Unless you are very poor, then you get it without it. But then for this, we have special rules. We will see that in tomorrow's presentation. How are foreigners integrated in such national health system? Depends on the countries and on the situation of the foreigners. When I used to live in Britain, it was very simple. I was learning English and was doing some au pair work in some families. The lady took me to her doctor and they said, well, this is Monika, please put her on your list. And he took my name and my birth date, and then I was part of the National Health Service. I still have the card, I think, for memory. So everybody who was legally in the country was automatically part of the National Health Service. Now, if you are illegally in a country, then countries have all sorts of different rules. But with all these refugees and migrants in Europe, most countries have provision now for illegal migrants to treat them. You know, if somebody has a very life-threatening problem or has a big pain or, you know, whatever, even dentist pain, there will be something for these people and they won't need to pay. But social workers will tell you the way to get there, or hospitals have special departments for this. So foreigners, you have to distinguish legal ones and illegal ones. Now, this is a health service system. The service is provided, you don't pay except a little out of pocket. And the government will organize it all. With the public administration, it will be managed. Now, social health insurance systems, what sprung out of Bismarck, these three functions can be organized by various actors, public, private, or mixed. The government sets the major rules, and then those who manage the health insurance, they have to manage their health insurance, keep within the money they get from the contributions, not make public debts, and but following the major rules from the government. So what are the rules in the government? In these countries, mainly, well, there are differences between the countries, but most of them, it's the government who sets the percentage of contribution these health insurances are allowed to take from you. And generally, it is a little margin, maybe between, let's say, between 12% and 12.3% of your salary or of your total income. It depends on countries. In France now, you pay your contribution to the health insurance from all your income. If you have an apartment which you hire to somebody, you are supposed to declare it and pay social contribution on that. In Germany, it's just the money you earn from your employer. And of course, this money, the 12 or 13%, they are divided. Half will be paid by the employer and half by the person. So you will have 7.5 to pay in France, in Germany, and many other countries around this for your health insurance. And the rest is paid by your employer in the regime of social health insurances. The coverage will be compulsory. Everybody will be obliged to be a member of a health insurance. And so you cannot just work somewhere and not pay your health insurance. That's not possible. The employer will take the money away and send it to the health insurance where you should be member. And or you can choose your health insurance and you tell your employer which one and he sends the money. It's taken away straight from your salary. You don't even see it. So it is financed, the whole system, by compulsory social contribution, as we call it, according to income. Now, if you have a commercial health insurance system, Switzerland had a very private system a long time, but it was running quite well. It was a bit expensive, but you will have a private insurance logic. Clients will be voluntarily, they will not be compulsory members somewhere. They will choose the insurance which fits them best. So all the healthy people will go to an insurance where they're only very healthy people because they will take less contribution because they don't need to pay so much for the ill people. Now, what happens to the very ill people who may not have so much money to pay so high contributions, but they will depend somewhere on public services, some sort of territorial service. So it's a collectivity who will look after those who have most needs, and the private company, insurance company, will take the money from those who don't need much, but who pay. So it's a very good business. Commercial health insurance systems have a private business logic with voluntary clients. They have to do marketing to find the clients. That is expenditure, which the social health insurances don't need to do, so that's economy. Managing a system costs much more in the commercial health insurance systems than in the social insurance system. And the cheapest for management is the National Health Service. because you don't need to run after all these contributions. The government sends part of the taxes and you just run the services. But in the social insurance system, you have many insurances very often, not just one. And they all have their staff and their buildings and their rules and their strikes and whatever is part of it. And it costs more money. France spends in average about 6% of the total health expenditure as administration, which is enormously high compared to other European countries, because they have a double system built up with the public and the private health insurance. I talk about that later. So the private health insurance will take premiums. We call this premiums, not social contribution. And they are according to the client's risk. If you have bad health, if you are very old, you pay much more money than when you are young and in good health. And you have to declare all your former illnesses, because they won't insure you if you didn't say that you already had a heart attack or you had already cancer, and then you have a second one, attack or whatever chronic illness. They will say, oh, this was not in our papers. You didn't pay for that. We will exclude this. You will not get the money. But this doesn't exist in social health insurance systems. They take you as you are. So in Germany, where you can choose now freely your health insurance, that was not the case before. You were belonging to some professional organization. So it was organized by professional branches or industry branches, the health insurance system. Now you can choose. They introduce competition that the health insurances should do better job with less money. And they put a rule: if you want to enter a health insurance or change your health insurance, they cannot refuse you. They're not allowed not to take you because you are too ill or too old. They have to take you. And to the normal premiums, to the normal social contributions, the normal percentage. They can't take more because you are older. Private health insurance will do that. And all the supplementary private insurances that people take out to cover things that the public health insurance doesn't pay for, instance, expensive dental care or things like this, they will take more money according to your age. It will go up and up and up. And in the end, it's not worth anymore to insure yourself if you're relatively healthy, because it costs more money in contribution than you ever can spend in a hospital. So, but then also you have options to extend your coverage in private health insurances. Formerly, it didn't exist in social insurances. You had a care basket, which was the same for everybody in each insurance. The different insurances could pay your thermal, how do you say, when you take baths and care for people with water, hot and cold water. Some of them, they did this. You had the right to have such a 2 weeks or 3 weeks of care for prevention every 3 years or every 4 years. It depended on your health insurance, how rich or how poor they were. But the commercial health insurance, they can offer you options to pay all your dental care or to pay your this and that, what you normally wouldn't have in the main package. So now, in the name of concurrence, the social health insurances do that too. Not yet in France, but in Germany they do it. You can have different options and you can add and then pay a bit more and then you are better covered. It avoids more private health insurance business, because inside the public health insurance, you can have a little sort of private market with these options. And it's generally around glasses and dental care and what else? Dental glasses, or maybe something like wheelchairs or equipment like this. So in commercial health insurance systems, the role of government is minimal, unless there is some public-private agreement. And this is what happened in Switzerland. The Swiss decided some years ago, maybe 10 years ago, that every Swiss person needs to be health insured. Before it was free. You could be insured or not. If you were not insured, you had to pay all the medical expenditure out of your pocket. So they said every Swiss person, everybody who lives in Switzerland, foreign or Swiss, has to have a health insurance. But all the health insurances were private insurances. So the government got organized with these private insurers, said, well, you have to insure all these people. So I bring you a supplementary market and I will fix some rules. So even if it's commercial business, the government came in to regulate much more about their business because they made it compulsory for everybody to be insured. I hope this is clear for you. Okay, I think I said the most important things. So on these three different types. Now let's say from an empirical point of view, what this means. So taxes or contributions are paid according to income. Premiums to private health insurance are paid according to the risk you represent for the insurance. If they think they have to pay a lot for you, they make you pay high premiums. So they will consider your state of health, whether you have overweight or whether you have addictions, previous illnesses, family antecedents, chronic conditions, age, number of co-insured family members, eventually your profession. Or if you are a lawyer, you may pay less maybe than a lorry driver because you have less, oh, sorry, it slipped away. You have less risk of having a car crash. Your living area, it may be a polluted area or very nice area, environmental risk, etc. They will have a whole list of things, of criteria, and you will have to pay according to the risk you represent for this insurer. So private health insurance needs all this personal health data for the risk calculation for each subscriber, each option, in order to keep within the respective profit margins, that they don't lose anything on any of their members. So the social insurances, they don't have all this. They insure everybody. And if the money is not enough, they may have a very big political discussion with the government whether they can increase for 0.1% the contributions. But that's a political question. It's not them who can decide it alone because the state regulates these things.